Department of Physiology, Mahatma Gandhi Medical College and Hospital, Jaipur. She is the chairperson of Curriculum Review Committee for Physiology, UG Medical Education Board, NMC, and she is the convener National Medical Commission, National Medical Commission Regional Center, Department of Medical Education. She has more than 20 publications in national and international journals. Thank you, ma'am. Ma'am will give a lecture on a reflective practice, the portfolio building, learning from experience.
I just want to add one point that reflective practice is more and more integrated in medical education and in developed countries. Portfolio is given more and more emphasis rather than logbook, and it is integrated with medical education to enhance the not just learning but also as a professional development and learn skills. So skill development. So that's why it's very very important topic. And let's start.
A very good afternoon to the warm reception. I have just reached last night from Ludhiana for the NCHPE where we had a workshop. A very interesting topic and a very important topic in today's agenda. I will try to do justice to this topic of reflective practice and portfolio building. The objective of this session to understand the importance and definition of reflective practice in healthcare, learn how to use reflection to drive continuous learning from daily experiences, explore the various models and techniques for effective reflection, understand the role of reflection in building a robust professional portfolio. Definitely reflective practice is a stepping stone to build your portfolio. And finally, gain practical tips for documenting and presenting the reflective evidence. I just had a Slido. I think so I'm offline. Just give me a second. Responses. Please scan this and just will have some responses. First response, good introspection. No idea, that's a very honest answer. We still have two participants typing 4. Opportunity to improve, how it happened, what happened, influential feedback. Decide on next action. Behavioral modification, perception, recalling experience and looking forwards about its future experiences. Again, a similar response, behavior modification, future directions leading to some pathway, registering memory. Okay, so we have quite a lot of responses. We just have this word cloud, self-regulation theory, cognitive reframing, perspective talking, self-compassion, community counseling, intellectualization, interpersonal communication. So there are obtained numbers or mnemonics for the word reflective writing. You name it anywhere, it will be the same. So reflective writing by definition, learning doesn't end in classroom. So whatever we have learned since our UG, PG, kindergarten days, we have not left it there. We still incorporated them in our lives. Similarly, the undergraduate teachings, the postgraduate teachings still continue. They sometimes haunt us, they sometimes give us a blissful happiness, a recall. So, reflective practice allows us to analyze these experiences, understand what went right, understand what went wrong, and improve to the next step. So, by definition, according to the AMEE guidelines, a metacognitive process, thinking about one's own thinking of learning through examining experience is called as a reflective writing. So what are the benefits you get with the reflection? Analyze and evaluate your experiences, integrate the theory and the practice, encourage your self-awareness, you can track your personal and professional growth, develop critical thinking as it analyzes your day-to-day action, empower learning, and since it is related to patient care also, we can have a better patient care. Hatton and Smith in 1995 identified 4 different categorizations of reflections. First, critical reflection, that is a description of what happened. Dialogic reflection, an account with reasons, justifications and explanations. Descriptive reflection, the learner begins to understand from the event and analyzes their role. Descriptive writing, the learner shows awareness of a wider context and that events may be located in and influenced by multiple historical and socio-political contexts. I guess in some way, day-to-day practice, we are all implementing it without knowing the actual concept that this is what we are practicing. So, a common framework for a reflection is the most commonly used Gibbs reflective cycle. In this, it's a cyclical event and we have 6 major parameters. Description, that is what happened. Feelings, what were you thinking and feeling about that occasion. Evaluation, what was good and bad about that experience. Analysis, what sense can you make out of the situation. Conclusion, what else could have been done better. An action plan, if it were to arise again, what would you do? So to understand these 6 difficult words, I just have a case scenario for implementation. Now this is a case scenario, a hypothetical situation is on a busy surgical ward during a night shift. She is responsible for administrating medication to several patients. An elderly patient, Mr. Jones, needs his routine oral medication at 10 p.m. Sarah enters the room, but the patient is asleep. Anxious to keep on schedule, she decides to wait until the morning shift rather than wake him up. Later, Mr. Jones' condition slightly deteriorates overnight and the morning nurse notes that the dose was missed. So if we have to analyze into this reflective writing, if we go one step by one step, description. That's the first step of the cycle. What happened? So what happened in the entire situation? It is reflective writing is always as I. So I was working the night shift and responsible for administrating the dose. He was asleep, so I decided to omit the dose and wait for the morning shift. I did not document this decision or inform the senior nurse at the same time. So outcome, Mr. Jones' condition worsened slightly and the morning nurse identified a missed medication. So this is exactly as what happened and we are reflecting on the entire scene रात में. तो हम लोग ये यूजुअली वार्ड में करते हैं, कोई गलत होता है कुछ होता है तो हम रिफ्लेक्ट करते हैं, शुरू से बताओ क्या हुआ. तो ये शुरुआत है कि व्हाट हैपेंड. तो आप क्या सोच रहे थे, आपने ये क्या सोच के किया या क्यों किया. तो उसका रिस्पॉन्स था नर्स का, आई फेल्ट एंशियस अबाउट मेकिंग द पेशेंट as he seemed to be resting peacefully and I didn't want to disturb. After the event, what was the condition? अब मुझे रात में पता चला कि पेशेंट डेटेरियोरेट हुआ, तो मुझे अफसोस हुआ and I was disappointed that मुझे उसको उठा के दवाई दे देनी चाहिए. So these were the feelings and reaction. Evaluation. What was good and bad about the same experience? Good aspect, I was being considerate, but bad aspect was the negative was on my decision. And it was a single-handed decision that I decided without the consultation of the treating doctor or the nurse that should I miss it or shouldn't I. Coming to the next aspect of the cycle, analysis, linking theory to knowledge. My actions were influenced by lack of confidence in my decision making and according to best practices, prompt and current medication examination is crucial for patient stability. My hesitation to follow protocol was a result of time pressure and a fear of making an immediate disturbance. So considering influences, busy environment and desire to appear competent in control of my workload also influenced my decision. Conclusion, हम और क्या कर सकते थे? So the main lesson I learned is that the patient safety and adherence to the prescribed treatment plan must always be the priority. And action plan, if it was to happen again, I will follow the steps as prescribed. Even if the patient is asleep, I will gently wake him up and give the desired dose. So in this class or in these few slides, I have tried to come together description, what happened, feelings, what were you thinking, evaluation, analysis, conclusion and action plan. So this forms a reflection of the entire hypothetical situation which has aroused, and this is the normal gift reflective cycle. Another type of reflection is Sconce model, that is reflection in action. Reflection on action and reflection for action. तो अगर ये हुआ तो करते करते हम सोचते कि मैं सही कर रहा हूँ या गलत, तो that is reflection in action. Reflection on action means हमने कर लिया तो वो सही था या गलत, जब उसका रिजल्ट हमें पता चला उस पर हमने रिएक्ट किया तो that becomes reflection for action. थोड़ी कॉम्प्लिकेटेड है लेकिन एक बार प्रैक्टिस में डालेंगे तो आसान हो जाता है. Then these are the relevant types of reflective writing. Bristol's model of reflection, what happened, so what, and now what. Era's cycle, experience, reflection, action. Kolb's reflective cycle, concrete experience, reflection, observation, abstract conceptualization, and active experimentation. 4 F's of active reviewing, facts, feelings, findings, and future. There are many more online available, but these are the few commonly which we are using as a medical educationist, so this can be considered for evaluation. For every good thing, there are barriers to effective reflection. So what are the challenges? Poor understanding of what do you mean by reflection, lack of time, proper feedback from the stakeholders, and fear of judgment. In one of the morning session, I heard the word there is a 360-degree feedback. So whenever we have a proper feedback, our reflective writing improves and reflection per se also improves. So overcoming these requires supportive mentors, time management, and a culture that values learning from mistakes. So reflection is powerful, yet it has challenges. From these experiences to evidence forms your portfolio. Building your portfolio through reflection. A purposeful collection of a student's work that tells us a story of effort, progress and achievement. In short, portfolio differs from CV. CV, we just say that I'm this, I'm that, I'm working here, these are my qualifications. But portfolio has the documentation that are you truly doing this? Are you truly a convener? Are you truly published so many things? So whenever a documentation is taken into consideration, it becomes a portfolio, and CV is just words gathered together. So benefits of having portfolio building: promotes self-directed learning, provides proofs of achievements, and it is definitely useful during appraisals or interviews. Whenever we have the annual appraisal forms in our college or institutes, they do ask us, what has been your academic achievements? So whenever we have those academic achievements, we document it by proof, so that is a part of our portfolio. And it definitely encourages lifelong learning. As we say, whenever there is an incentive accompanying anything, definitely there is a learning. And last not but the least, builds confidence and makes you a professional identity. Portfolio gives two types, a dual learning, learning versus assessment. So learning is formative and summative. Students' profile includes multiple sections about themselves, their work experience, the courses they have done, accomplishment, the batches, the hobbies, skills. All these achievements, when encompassed together, gives them the student's portfolio. Why portfolios matter? So a well-structured portfolio includes evidence of learning, reflection, scoring criteria, the rubrics, and personal statement. This everybody is aware of. Evidence of learning is your projects, paper publication, log books, patient records. This is only the evidence which we can start with. Reflection is how do we proceed. Criteria points is the CME credit score, the CDE credit score, the NMC credit score. That is what we get. So they build up your portfolios. The components of portfolio, I have again repeatedly said that documentation is the most important way to make your portfolio a strong concept. The critical element along with the documentation is your reflective process. So to understand, the last is digitalization is the key in practicality. So going digital just labels it as e-portfolios. It is nothing else but the portfolios which you are keeping. So it's a dynamic, accessible, easily shareable, allows for multimedia evidences, easier organization and storage. हमको आज कोई सर्टिफिकेट मिलेगी, हम उसको स्क्रीनशॉट करके अपने आप को मेल कर देते, तो that's an e-portfolio which we have created for ourselves. I will go back to my institute. I had a session, but I need documentation. So they will just not take the letter, give it to me, or the verbal communication. So I need to update them, the letter which I received from NCP, the attendance certificate which I will receive. So these are the documentary evidences which I have to support for my portfolios. So reflection and portfolio together form an experiential learning, and this is a cyclical event. Experience, you reflect, you document, you give a feedback, there is improvement which ultimately leads to excellence in your career growth. So when reflection and portfolio come together, they perform a powerful learning cycle, and this is how students grow into professionals and professionals into experts. These are few scenarios which I have just taken to make a better understanding of the portfolio. A situation is, it is an interprofessional collaboration and teamwork. Situation is a physician working in an OPD, patient with poorly controlled diabetics and complex social need requires input from a range of services. So we challenge it, we reflected on the scenario, and how do you analyze it in the portfolio? You will give a coordinated plan. With the patient came, I reflected on this is what I did. Documentation, मैंने इसको बुलाया, मैंने उसको मेल किया, तो these are the documentary evidence. Reflective notes on the other approaches which you receive, and peer feedback from the social worker or from the patient regarding your collaborative skills. So this is an example for the portfolio making. A second example, demonstrating quality improvement and patient safety. Scenario demonstrating curriculum development and educational innovation. Scenario demonstrating professionalism and ethical practice. Scenario demonstrating clinical teachings and feedback skill. ये हमारे साथ regularly होता है. You are a senior resident member on a busy inpatient ward round with medical students and a junior resident. A complex patient with multi-system failure is being discussed. The junior resident presents the case poorly, missing key diagnostic details and appearing stressed. So the entire team becomes under stress because the presentation did not go well. So the action or the reflection which we could do, you recognize the resident's stress. Instead of criticizing him publicly, you opt for the OMP model or some similar feedback approach in a quiet area. So in your evidence you will say, 1 minute preceptorship done, evidences, reflection on how did you approach, the feedback from the resident and the further reflection on how did he perform for the next cases. This is how you build up your reflection and reflective practices. Essential for effective reflection and portfolio building, the most important is honesty and integrity, self-awareness, you should have a framework, regularity in reflection, documentation, and always seek support if you are lacking in something. Reflective practice is a critical process for turning everyday experience into meaningful professional growth. Portfolio is the product of this reflection, a powerful tool for demonstrating competence, learning and commitment to lifelong development. How do you act it? Start a reflective journal today. Use any of the models prescribed. Gather your evidence consistently and schedule a time for regular portfolio reviews. So the take-home message, together reflection and portfolio helps us develop as a confident and self-aware professionals. We have already seen reflection is the most valuable part of this process, which is purpose, organization and seek mentorship whenever required. So this is the 21st century portfolios, which includes all the key structures, how we teach, what we teach, reflection, content standards, effective assessment, teaching and learning, and it focuses both on the process and the product. So thank you all for a patient listening. Thank you. That's all from my side. Thank you so much.
Thank you, ma'am, for such a very relevant and insightful presentation. Your presentation reminds us that we learn from, not from experience, but we learn from reflection or experience. हम अनुभव से नहीं सीखते, अनुभव पर विचार कर सीखते हैं.
जी सर.
As medical educator, this is our responsibility to incorporate reflective practice in our day-to-day practice. As in rapidly changing medical world, the ability to learn from experience is not optional, it is essential. Thank you.
Dr. Aparna, it was beautifully covered, extensively covered. I must say that the topic of reflection and portfolio building, we have to make an integral part of medical education to develop all the three domains. You will agree that for learning skill, not just for learning, for development of professionals, we need integrated approach of reflection and portfolio. Now, as you mentioned, you also touched about the quality assurance. Most of the accreditation councils, for say example NAC and NIR, National Institutional Ranking Framework, they are focusing more on how innovatively you are implementing the teaching program. So implementation is very, very important, teaching learning methods. And I have seen in South India most, and you also tell about the e-portfolio. Now e-portfolio should not be very difficult to implement, because most of the junior doctors, junior doctors are millennial generation. It may be difficult for say alpha generation, the female generations. Millennial, that should, and Gen Zs are all new generation born in era of internet. So it will not be very difficult to implement e-portfolio. And many South Indian good colleges like Mahe and all, they have already implemented e-portfolio. They have implemented the entire paperless examination system. So we have to move toward that line, and it was beautifully and extensively covered the topic. Thank you very much.
Thank you so much.